fracture. A fracture is a broken bone. It can range from a thin crack to a complete break. A bone can fracture crosswise, lengthwise, in several places into many pieces. Okay, you can go to the next slide. More common fractures: stable fracture, compound fracture, transverse fracture, oblique, and cumulative fracture.
Some of these common types of fractures are avulsion fracture, which is a muscle or ligament pulls on the bone, which fractures it. A compression fracture, which generally occurs in the spongy bone in the spine. A fracture dislocation, when a joint becomes dislocated and one of the bones of the joint has a fracture. A green stick fracture, which is the bone partly fractures on the side but does not completely break. A hairline fracture, which is a partial fracture on the bone. Sometimes this type of fracture is hard to detect with a x-ray. An impact fracture, when the bone is fractured, one fragment of the bone goes into another. And an articular fracture, where the break extends into the surface of a joint. A longitude fracture, which is the break is along the length of the bone. And the pathological fracture, when an underlying disease or condition has already weakened the bone, resulting in a fracture. Some common causes of fractures are traumas, which is a fall, a vehicle accident, or a tackle during a football game. A osteoporosis, which is a disease that weakens the bones and makes them more likely to break. Or overuse, which is repetitive motion that can tire the muscles and place more force on the bone. Some symptoms for a fracture are pain, swelling, bruising, discolored skin around the affected area.
Angulation, that the affected area may be bent at like a weird angle. The patient is usually unstable to put weight on the injured area, or even with some type of pressure. That the affected bone or joint may have a grating sensation. Self-explanatory. If it is an open fracture, there may be bleeding. For the treatments of a fracture, to go and treat it, doctors will often use an X-ray for your to see where exactly is it fractured at within the bone. They will use an MRI or a CAT scan that may be ordered depending how serious that the fracture is. The bone healing, the bone actually heals itself. You just go and keep it in place so the bone can actually heal itself through time. And you can also use painkillers because treatment also focuses on providing the injured bone with the best circumstances. So optimum healing, so just like what I was saying, just making sure the bone stays in place. And also the bone basically again, this bone has to just stay in place. Minor and major type of fractures. A simple fracture is a closed fracture. It's not as serious. It can be healed within a few weeks. The ends of the bone are broken, but they're not out of place, which is good. The break stays inside of the skin, and that's just a minor fracture. Now, a major fracture is known as a compound fracture, which is an open type of wound. This right here is more serious. It can be healed within 6 weeks, depending on the location of the bone and depending on the person itself. The bone punctures through the skin, which is why it's called an open. And this makes you more susceptible to catching a disease and the fracture itself getting infected.
The 4 stages of the healing process for a fracture starts with the hematoma formation, which is basically the bruising around the fractured area. And then you have the fibrocartilaginous callus formation, which is when the new blood vessels form and some of the blood reaches the outside of the skin, causing some bruising. And then the 3rd stage is the bony callus formation, which is when the bruising starts to go away and bone of the spongy bone forms. And then the last stage is bone remodeling, when the bone starts to form back into its original position.